we are going to perform trach suctioning. I have assessed the physician's order for the need for suctioning, also assessed my patient for the need for suctioning, auscultating their lungs and around the trach site for moist respirations, and everything is good to do suctioning. I have gathered all of my supplies, a brand spanking new suction catheter kit, my hand sanitizer, sterile saline, my patient. I have the correct tubing, the canister here, which is set to 100 to 150 millimeters of mercury. And during the duration of this gathering process, I would pre-oxygenate my patient to 100% oxygen. And I would monitor their oxygen saturation before and during and after the procedure as well, during the entirety of this process, making sure that they're good. So, yeah, I would perform hand hygiene. And I would open our suction catheter kit away from me and grab that out and throw that away. And now I will be very careful of how I open this because I see the little box that we're going to use for our sterile saline. So we're just going to be careful as we open up our kit. So I am going to treat these fat borders as our 1-inch border. So maintaining that 1-inch border, I'm going to very carefully grab out our box for the sterile saline. So I see the bottom and the top, so I'm going to open this up until it clicks, making a box for our sterile saline. I'm going to set that by our patient, and then I will pour the sterile saline into our box. Labeled calm, and if this was a used bottle, I would lip it. It is not a used bottle, so I am going to just pour. Maintaining sterility of this box, pour enough for the procedure, recap that, and we're done with that. So now we are going to perform hand hygiene and don our sterile gloves. Again, treating this whole fat border as our 1-inch border. Making sure we don't touch our sterile portion. Okay. And now we will grab our sterile glove and don it. Thumb to the ceiling, making sure we do not touch that border, and don our next sterile glove. And that is backwards.
What are you gonna do? Critically think?
Well, it's still on. So. I mean, I could get another pair of sterile gloves. So don't have another pair on me, but I would. So I would just maneuver this so that it's nice and I can still move. I have full range of motion of my fingers. So I'm just gonna keep going. Now we can grab our tube here and very carefully, seriously, I ripped. Very carefully grabbing this out and throwing that away. Okay, so we are going to very carefully very carefully ravel this around our hand. Yes. And then we will designate a non-sterile hand and a sterile hand. Okay, so this is my non-sterile hand now. We're going to very carefully put this on without touching our unsterile hand or the unsterile part to our sterile utensils. Not utensils, equipment, but whatever. Okay, now we are going to dip this in our sterile saline and intermittently suction to lubricate this. So, suction, 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 get it all lubricated and nice. And we are going to make sure we are not pressing, engaging the suction upon insertion. We are going to hold our breath and insert and rotate in circular motion for 10 to 15 seconds while holding our breath so that we can be aware that our patient needs to breathe. So, do not engage suction. We're going to insert 6 inches, or we meet resistance or our patient coughs. Pull out 1 to 2 centimeters, and then we will begin suction in a circular motion, intermittently suctioning. Good, he's doing good. 10 to 15 seconds has elapsed, so we are going to remove and dip into our sterile saline, and then intermittently suction. And at this point, we could go for another pass, 30 seconds after, or 30 seconds between passes, but we are done here. It is suctioned and nice, so we are going to roll this up and disconnect. Now we can take our gloves off with the suction tube in our glove. And we will then perform hand hygiene after we clean up our mess here. We will document the color, consistency, amount of sputum or mucus or whatever was lodged in there. We will assess the oxygen saturation. We will just assess our patient and make sure that they are all good. Assessing how they, or documenting how they tolerated the procedure, the date, time, all the things. So, we're done.